This is an unprecedented time in our nation and our world's history as we respond and attempt to mitigate the spread of a pandemic known as COVID-19. Pathologists and laboratory professionals are the unsung heroes in this effort, as they comprise the backbone of the medical laboratories, which are conducting testing for the coronavirus. Pathologists and laboratory professionals are on the front lines 24/7, making sure that all of the tests are functioning, that we have the materials that we need, and most importantly, that patients are receiving the appropriate diagnosis and treatment in an efficient manner. ASCP is proud to showcase the behind-the-scenes work that our laboratories across the nation are doing to care for our population.
It is a privilege to have the opportunity to sit down with the chairwoman of NorthShore University HealthSystem, Dr. Kaul, who is both a physician, pathologist, and a PhD scientist, to talk about this unprecedented time in our nation with the outbreak of coronavirus. Dr. Kaul, tell us what your opinion is in terms of what is happening in the current crisis in the United States.
So I agree with you, this is an unprecedented time. We've not seen anything like this. And for a few of us, it may harken back to swine flu 10 years ago, but I think it's much more serious than that because of the nature of the disease. We have the opportunity to look to other parts of the world, other parts of this country, and get a sense of what to expect in the coming weeks. I think we have a lot to learn from what's happening, and probably some opportunity to improve our game, become a bit more organized, and face this head on, because I think it is going to change the way we live over the coming weeks and months.
How do you feel the role of pathology and laboratory medicine, the scientists behind the scenes, these individuals who are on the front line of detecting this disease? What do you believe is the ultimate patient outcome? How do you believe these individuals should be considered or revered?
Well, I'm obviously very in favor of the lab and appreciate that. That's what I do. So I have my biases. But, as you know, the lab touches everyone. Every patient gets touched by a lab multiple times during the course of their life. And we provide the data to ensure that patients are being treated properly for everyone. The right test, the right time, the right diagnosis. And that's what we do, generally a little more routinely than this, but quite honestly, this is what we train for. This is what we're ready for, is to jump into action and do what we need to do to work with our clinical colleagues and keep our patients, safe and managed properly.
And so, even though the patient may not necessarily see you on a day-to-day basis, you're the individual, and your team of 500-600 individuals that work for you, both physicians and laboratory scientists, are the ones that are the backbone behind medical diagnostics and the system that allows for patients to determine if in fact they do have this virus. So importantly, as we go through the next upcoming weeks and perhaps even months, it's going to be these system of practitioners that are going to be the vital players to providing health care for the nation's population.
I really think so, and even in the last few weeks, I've seen this group come together, support one another. They truly are amazing. So we started looking at this in January when we started hearing news from China, and anticipating that something was coming and we needed to be ready for it. And at the time, there were no tests available. CDC was developing its tests for the public health laboratories, but that is not something that a hospital laboratory can access. So as we looked at what was going to be available to us, it was clear that there was going to be a gap in testing. And laboratories that have a molecular diagnostics capability, who have developed labs in-house, validated those for clinical use, like ours, I think have the potential to do this again, and that's exactly what we did. We jumped into action. When the CDC published its primers, we decided to mimic that test, use that information, because we felt it would be the most certain way to get FDA emergency use approval for that test. Started working to validate this test in-house, first on engineered materials, but ultimately a few weeks ago we were able to get actual positive control materials, actual samples from other laboratories who were beginning to see some positives. So there's really a network of cooperation across the laboratory community in the United States, where labs will share information, share data, share samples, so we can help each other come up to speed to take care of our patients.
Right. So, of course, the American public's been very concerned about the paucity of tests that are out there. are we behind the curve with the rest of the world in Europe or even in Asia? Is it that, or is it the fact that we have been designing our own specific tests to get ahead of the curve? Which is it? And tell us a little bit about the different types of laboratories, whether it's a public health laboratory or an academic medical center such as yours that serve a very large swath of folks here in the Chicagoland area. But tell us a little bit about what you believe the interchange, or maybe even the interface between those laboratories and how they're different, and why what you're doing is significant too as well.
No, I think that's a great question, and I think it's something that's become very clear to me in recent weeks. So we have the public health laboratories that are part of a network with the CDC, and they are collecting epidemiologic information. They're also providing information on patients so that we know what's going on, but they have a certain testing capacity. Test has to be sent in. There's generally 1 or 2 such laboratories in any given state, and it's not something that can provide the service needed in any given hospital to make immediate decisions on those patients that are being cared for right now. Turnaround times are 3 to 5 days, for example. So I think coupled with that, and as I think about this crisis that we're in, this might be an opportunity for learning. We have the hospital labs, and we're really on the front lines of what's happening now. We have patients presenting in our emergency rooms, in our immediate care centers. You know, how do we help those patients? Because we need to make decisions that day as to whether they're going to be admitted for isolation, sent home and isolated, you know, admitted but not isolated because they don't have disease. And as the hospitals are really struggling with capacity management and how to protect their patients, protect their staff, we need that information that day. We can't wait several days for this information. So that's where I think hospital labs are really in the thick of this and are absolutely critical, but should be working, you know, perhaps more closely with the public health labs.
Right.
What we're about to see, however, is the corporate manufacturers coming along with kits and equipment that will allow us to test at a very much higher capacity. And this is going to be in general at some of the larger reference laboratories across the country. Those are just starting to roll out and are going live now. And so this will allow testing. I think it remains to be seen for us whether those places are going to be testing for the hospitals that can't do it in-house, or testing the worried well who will be going to these drive-by swab clinics or whatnot. But I think in the coming days this will sort out, but we need to have a seamless network across our healthcare system.
So if you were a patient in Chicago and you were concerned that you might be in fact exposed to this virus and that you want to self-isolate to prevent the contamination to occur or continue, what would be the optimal, if you were the patient, and also since you're the provider here, what do you believe would be the optimal turnaround time for the time they come in for an actual swab and your ability to process that, go through all of your molecular processes and making sure that it's the right test, but it's the right, of course, patient. But more importantly, what do you believe is considered to be a palatable number? Is it a day? Is it 3 hours? Is it 5 days? What should the turnaround time look like?
So I think it depends. If you are a potentially exposed patient but healthy, not showing any signs,
Right.
You might want to be tested. You might not need to be tested. You need to go home and isolate yourself and monitor yourself, check your temperature and so forth, and report into your healthcare provider. And that may be all you need. And I think that's in part why, you know, we're being advised to stock up on a few things so you don't have to go to the grocery store and expose others. On the other hand, if you're a patient who has got signs and symptoms, it's a different story. And I think some of those who are extremely ill are coming to our emergency rooms, and we're admitting them and dealing with that. And again, we need to know whether they're going to isolation. Our hospital is preparing to have COVID-19 wards where we'll be able to deal with large numbers of patients should that happen here. In the middle are patients who maybe have some symptoms, a cough and a fever. They may still have the flu. We're still in the flu season. And so those patients are going to our outpatient facilities. We have designated a few that are equipped and trained to deal with COVID-19 sample collection, and those are coming to the hospital as well. And I think for those latter two groups, the inpatients and the outpatients, but those who are ill, we'd like to know quickly. I think having results in a day or so is the appropriate time frame. We don't want to wait 5 days.
Clearly, and I think that the good news is that hospital medical centers like yourself have been working on engineering solutions for many, many months now. Patients aren't aware of that, in order to meet the demand and the throughput that's going to be required, correct? So if we, in fact, have been thinking that it just happened last week or 3 weeks ago, and we've been watching what's been emerging out of China or even out of Europe, quite honestly, is not the case. This has been a long haul. We've been working on for this for quite some time. And the ultimate goal is to have throughput so nobody has to wait. And it gives an option to everybody around the country. I think the good news scenario is there are multiple types of laboratories, as you mentioned, but communities care for their patients in communities. And you're in a community where you can't wait for it to be sent to a central laboratory, or the patient may not want, or it can't necessarily be a patient that you've triaged because they don't have every single symptom that there is. So having options and having the opportunity to work with your team of 500 to 600 scientists is a dramatic move in moving public health in the right direction.
So we've known this is coming for a few weeks, which is a long time, but not really a long time. So I think a number of labs across the country have been really trying to prepare for this. And I think it is a fortunate thing that laboratories that don't fit in either to the public health lab or to the large commercial reference lab can address these issues as best suits their clinical setting and their patient population. You know, we're expecting to need a throughput of 500 to 1,000 tests per day. I don't know if those numbers will be accurate, but we're trying to scale up to that, but we'll be doing it in a large degree with an assay that we were able to get ready quickly because we're able to do lab developed tests, and it's filling a gap, it's filling a need so that we can serve our health care system and our community, which is really what we're trying to do. I think the capacity for us to develop and in quality systems, which are fairly familiar to all of us that work in laboratories, develop novel assays like this is quite important, because we're more nimble than some of the other systems. We're more nimble than a large commercial laboratory. We're more nimble than the manufacturers, and so I think it's really a key part of our delivery of care system to have laboratories that can do this sort of thing. So the lab team continues to amaze me. I look at last weekend when a week ago we weren't scheduled to have any testing being done. We were able to go live not quite a week ago now, and the staff, and this is the way laboratorians are, the staff volunteered to fill extra shifts to meet the needs of the patient so that we could get the testing done in a timely fashion. This is what people do in the laboratories. People from up and down the hallway are watching the changing patterns of the work that they're doing as we're starting to cancel elective surgeries, for example, and they come together, help each other out, volunteer, whether it's phones, faxing, anything that we can do to keep their colleagues in the laboratory functional and comfortable and able to meet the needs. It's really an amazing thing, and that's what laboratorians do, and it makes me very, very proud of them. I'm not quite sure what the coming weeks are going to bring. We're all going to be working very hard. We're about to go to 2 shifts of testing, which will up our capacity further, and we will do what we need to do. But I think what is not appreciated by the public is there are these guardian angels here in the laboratory that are working round the clock to do things that will guide their care and make sure that the information needed by their clinicians is right there at their fingertips in the EMR. But people don't realize this is happening behind the scenes every day, 24/7.